Hello, my name is Amy Sturkey. I'm a pediatric physical therapist, and I had a request to do a video on scoliosis. So scoliosis is a condition that is more common in people with cerebral palsy. So what is it? It's a bending or a twisting of the spine. It is important to note that as the spine bends, it also tends to twist, kind of like this vine is twisting. As it curves, it twists. So not only do you get a shorter side, but you tend to get one side that's further forward than the other side. So scoliosis can be two different ways. One way is just the back curves. It can curve like a C curve is what it's called, and the more it curves, the more significant it is. But a curve can also curve back on itself. So it curves one way and then it curves the other way. Sort of like how this vine is curving one way and then curves back the other way. So there are two different types, but what they look at is how steep is that curve? Is it really steep or is it pretty straight? What they found is that people who have cerebral palsy, that scoliosis can increase until they're 20 to 25 years of age. So a scoliosis, how frequently you get a scoliosis if you have cerebral palsy depends on how significant your involvement is. So in the last video, I talked about the different levels of the gross motor function classification system. And I talked about level 1 and level 2. Those are the people with cerebral palsy who tend to be able, who can walk. Those people have scoliosis just about as frequently as neurotypical people walking around. However, if you have more significant involvement, you're more likely to have a scoliosis. On the level, the gross motor function classification number 5, 75% of them have a scoliosis of at least 40 degrees by the age 20. And you can see signs of the scoliosis starting by age 5. So it is important because scoliosis can start so young. It's important to start getting x-rays early so you can get a baseline so you can see how the scoliosis is changing over time to make sure you catch the scoliosis to see if there are things that you can do about it to improve it. So what causes scoliosis? It's caused by the spasticity or the stiffness in the muscles of a child who has cerebral palsy, or in the weakness that they have, or in the motor control that they have. They may only have strength on one side, so they always go off to one side, and that encourages their back to curve over time. So what do they do, and how do you know if you have a significant scoliosis? Well, the best way to know is to get an x-ray. The things that you can do or look for is if you have a mild scoliosis, the only way you can tell you have a mild scoliosis is you have someone lean forward, and when they lean forward, because of the rotation component in the scoliosis, one side of their back will be more prominent than the other side of their back, and that's with a mild scoliosis. Now, if the scoliosis is more moderate, you can actually see that what's called a rib hump. You can see that whether they're leaning over or not. They're sitting or standing, you can see one side of their back be more prominent than the other side of the back. And if it's a severe scoliosis, that means that the person with the scoliosis can't sit or stand without extra support because of how curved their back is. So you might ask, what are some of the other signs of a scoliosis? Well, because of the rotation component, often there's a rib prominence on one side of the body or the other side of the body, in the front or in the back, that helps you know that your child may have a scoliosis. If you see an uneven waistline, then again, that's a sign that you probably have a back curve. If you have one hip higher or even more further forward than the other hip, that's a sign that you might have a scoliosis. Similarly, if you have one shoulder that's higher than the other, again, it's a sign that you might have a scoliosis. So what I have seen clinically with my children with cerebral palsy is I can kind of watch a scoliosis, it's kind of but when children go through bigger growth spurts is when I've seen the scoliosis just take off. because what I think happens is with cerebral palsy is when the bones start to grow and the muscles are stiff, it won't allow that back to grow straight because it's pulling that vertebrae down. So what I've seen during adolescence, especially during those big growth spurts, and what I've seen especially with boys, is that back will go from a little bit curved to, oh my gosh, what have I done, curved back. So it's really important to monitor these kids over time, and especially around big growth spurts. Well, the research says that at 40 degrees of a curve, that it's important to start considering surgical intervention. It all depends on the kid and the situation of whether they think surgery is the most appropriate thing. Certainly if it's putting pressure on the lungs or the heart, they're more likely to consider surgical intervention. The treatment options for scoliosis are a couple of things, and often they're used in combination. So one is physical therapy. So physical therapy can help strengthen the trunk. If you have asymmetries in strength that are causing the scoliosis, it can help address those issues. You can do equipment positioning, so the wheelchair, the stander, the seating device, all making sure that those things address the asymmetries that are causing the scoliosis and help get you in a more upright position so you can strengthen the muscles in the upright position and not the curved position. You can do bracing. Bracing can help support the trunk in a more upright position, stretch out the muscles to help discourage the progress of a scoliosis. And then obviously the last choice is surgery. The surgery options have really improved over time. So they are better at improving scoliosis and providing growth options so that a growing spine can be corrected too. So these are all the things that can be done to address scoliosis. This is just a real basic introduction to what scoliosis is. You can certainly look up more information on it, but I hope this was helpful. If you're asking and thinking, yes, I do believe that Sebastian is really at risk for developing a significant scoliosis. He's got asymmetries. He's a level 5 gross motor function classification system child, so he's really at risk for scoliosis, and it's important for him to be monitored. If your child is a level 5, 4, or 5, please get your child monitored to try to help catch and keep tabs on your child's scoliosis so that your child can get appropriate treatment options. I hope this is helpful, and we'll look forward to seeing you next time. Thanks. Bye-bye. If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.